Day 2 of how to be an art therapist in a mental health facility. So this is another key and very important one that I learned very early on, is how to set boundaries. So what I mean by boundaries is actually setting boundaries with patients, but also with staff members and also with fellow clinicians. So part of the boundaries with the patients is making sure that they have a safe space to work in. So that is allowing them to express themselves, but also within reason. So depending on the day and the mood, you don't know what you're going to get. Some patients could be elevated or can be really actually flat and not wanting to participate. So my job in creating that boundary is making sure that they feel safe, they feel like they can make their art, not be judged, and also not be judged by their peers. Boundaries with staff members is a little bit different than that. So when you set a boundary with a staff member, that's actually like some of the nurses and some of the techs that do help out with the patients. It's kind of just, making sure that they understand what you're there to do and what your job is. So the boundary setting has to do with defining your role and your role with the patients. Lastly, setting boundaries with other clinicians. That has to do with me because I also do have a behavioral health master's, so I am able to work with them closely doing some behavioral health. But the whole point of this one is that you need to stress what you're there to do, because sometimes it gets mixed up. The boundary has to do with defining your position and knowing, or actually letting them know what you do there. So if you're in a facility that hasn't ever had an art therapist like me, where I've implemented the program, it is kind of educating and showing them what you do with the patients and what your capabilities are. One thing that I have learned and really has helped with educating other people that work in the hospital is to invite them to some of your groups. It really is helpful. They get to actually partake with the patients. The patients kind of love it. It's kind of like when you were a kid and you had your teacher come into the classroom with another teacher. They love that stuff. So that is one thing that has definitely helped me, is inviting the other clinicians to come in and see what it is that I do with the patients. This one is that boundaries need to be created in order for you to do your job properly. So it is telling the patients what your boundaries are, not even telling them, just kind of making it defined in the very beginning, and also what you will accept and won't accept. And that goes all around in any job that you're in, is just making sure that you are confident in what you're doing and that you're being supported as well. Stay tuned. Tomorrow I got more. I'm Jean and I'm an art therapist.